Hello and welcome, everyone. Thank you for joining us today. In the rapidly evolving world of home-based care, we all know that the ultimate goal is to provide the highest quality services to our patients and their families. While we often focus on the clinical and operational aspects of care, there's a powerful and sometimes overlooked lever for success right in front of us, the family caregiver. Today, we're going to dive into how a proactive and strategic approach to communicating with family caregivers can be a game changer. We'll explore how building strong communication channels not only improves the quality of care, but also drives tangible growth outcomes for your organization. You'll learn practical ways to improve beyond simple feedback and truly integrate the caregiver's perspective into your daily operations and staff training. We have two fabulous presenters for you today, Kara Abbott, the CEO and founder of Better Leave, and Michelle Hyde, the Executive Director of Village Home Health and Hospice. We also have Sam here today from Better Leave, who will be moderating your questions. They'll tell you a little more about themselves in just a moment, but before I turn it over to them, let me cover just a few logistics for today. First, this is designed to be an interactive webinar. We will have some polls for you to participate in, and we'll leave the chat open and invite you to post your questions and comments there throughout the presentation. Second, this is being recorded, and the recording will be shared with anyone that registered for the event shortly after we end the session today. We also have shared a link to the slides in the chat. We have a lot to cover, so with that, I'm turning it over to Kara and Michelle.
Thank you so much, Denise. So thrilled to be here today. And also, Michelle, thank you for joining us. Really excited to have what I like to call this interactive fireside chat style conversation with an expert like yourself. Before we get into your background, love to introduce myself to everyone on the call. As Denise mentioned, I'm the founder and CEO of Better Leave. We're a digital health platform, and what we do is family caregiver communications. And our goal is to help groups, home health, hospice, palliative, in the post-acute space, reach more family members in real time in order for them to get real-time feedback. We do this through text-based SMS messaging. So just like you would talk to your auntie, or your uncle, or your mom, or your dad, or your sister through SMS messaging, no apps, no portals, no logins. It's that simple to get care at your fingertips. Before I created Better Leave, I was an end-of-life caregiver for my mom. And that changed my life. Going through that journey from cancer diagnosis to palliative, home health, and hospice, I understood the types of care that patients need, but also the types of care that family members need. And as we all are a distributed world, we know that sometimes family members need digital support. So super excited to talk to you a little bit about my background and what led me here, but really excited to have Michelle Hyde here, a veteran and industry expert in the space, the executive director of Village Home Health and Hospice, but also so much more, a background working as the executive director within assisted living, as well as skilled nursing facilities. So really, Michelle has seen the entire kind of post-acute continuum, which is fantastic. She's certified in a lot of different areas, including Texas Administration for Home Health and Hospice, CHAP, intensive certification. So really, I would consider Michelle a thought leader and an industry expert. So Michelle, thank you so much for joining us. I'll hand it over to you also to give a little bit of intro and background.
Hi, well, it's great to be here today. I've been a nurse now for 24 years, started in the acute care, and have come the whole realm in my career path as a nurse, and studying as far as education wise too. I've done everything from being a CNA many years ago, to being an ICU nurse, to teaching at universities, to now managing home health and hospice. I too went into home health and hospice because of my father, and it's a different experience when you're the caregiver and the nurse, or are a nurse. It's a very different experience, and it's a wonderful time. It's a stressful time. Even for us as caregivers, it's a stressful time, but it's a wonderful time to have such a wonderful experience with hospice, and that's kind of my philosophy with hospice. And I'm so proud to be part of this today.
Yeah, awesome. I agree with you. I think a lot of people we meet too have these personal journeys and stories that shape our experience of why we're in this space. So thank you. Thanks for sharing that. Also, I wanted to give a shout out to Sam. She's on the call. She's our head of product and experience here at Better Leave. She's going to be moderating the chat as well. You'll see her throughout. So please, let's make this really interactive. Ask questions. I know this is probably a lot of people's lunch break, so you don't come off camera if you're eating your salad or your cheeseburger, but feel free to ask questions that you have. We're going to have polls. We're going to make it really interactive. We want to make sure that we address things that you guys really care about today. So enough about us. Michelle, gonna kind of go into the agenda. Again, we have a little under an hour. So what we really want to try to capture is one key takeaway. We have an acronym we've created to help you guys kind of think about this content. But if you aren't an avid note taker, no worries. We're going to be sending you this PowerPoint. This is going to be live. You can access it at any time. It's on demand, so don't worry. But what we're really going to talk about is the family caregiver communication, different methods of communication, how often, frequency, the types of messages. We're going to dive into family caregiver expectation setting. Us as consumers and family members, this is important. How do we set expectations with those families right at admission? So we're going to talk through that. All of these pieces that we're going to chat through, we're going to tie back into your outcomes. So quality scores, survey results, getting real-time feedback. How do you take negative feedback and turn that into a positive or an attractor, what we call a detractor feedback into a positive attractor feedback? How does that show up on your survey results? We're going to talk about all of these pieces. And we're also going to dive into Michelle's background and ask her some tips and trips. Trips and, oh my gosh, ticks. I can't say it. Tricks, tips and tricks. Okay, we're moving on about her background and what she's done and things that she's learned along the way. So with that, I have to get the marbles out of my mouth in the first couple of slides, right? Let's talk about some challenges. Let's on the next slide, we're going to ask a poll of the audience of what some of the biggest challenges are today. But Michelle, in your experience, you're an innovative, forward-thinking leader. What have you seen throughout your career are some of the biggest challenges as family members have grown, family members have become distributed, maybe family members have different expectations of how often you talk to them. Like, here's some general challenges, but what have you seen from a challenge perspective that's evolved for family members and family caregivers?
So, one of the biggest things is you have a lot of elderly taking care of elderly, those different types of resources, and those will take a different resource and a different style of communication versus the baby boomers that maybe have us as their children taking care of them. So you're going to have to be very unique and try to understand the communication style that each person needs, and you need to be able to meet that need.
Yeah.
Just like CMS and CHAP requires us to have specific care plans for that patient, you need to also on the side be developing those care plans for the family. They're the ones ultimately that's going to give you your information that you're wanting back. They're the ones that's in charge of that care plan and the care of that patient. So how you communicate and what you choose to communicate really affects your outcomes with those different type things.
I love that you mentioned the care plans, and we're gonna dive and talk into this. But I think especially with the Hope tool on the hospice side coming down around real time, capturing data in real time with the family members, I think it's even more important that you're looking at these care plans continuously, both for the family, both for the patient. Also, I think what's really interesting that we've learned is the bereavement starts at admission. It doesn't start at death. And so that's another big piece around communication that we'll dive into today. But a lot of these other ones that we hear are If you don't engage with a family member, you're not going to get the survey response back. You might get mismatched. You might give the best level of care, but it doesn't reflect on the survey. That's a really
Correct.
frustrating one that we hear. How do you have that uncomfortable conversation to ask for Google reviews? That's a big one that we hear that we'll kind of touch on, which is some nurses and some staff like just don't quite feel confident or comfortable on how to do that. So how can we equip our staff to ask for that review? That can be really helpful. So these are some of the things that we'll talk through that are some challenges. But I kind of want to ask the audience on a poll today, what are some of the biggest challenges that you're facing when it comes to family caregiver communication or family caregivers? Are there key challenges that you are seeing? You should see a poll just pop up on your screen here. Feel free to click the responding button and hit submit. We'll give folks just a minute or less than a minute to complete.
And if folks aren't seeing that as a pop-up, check in the chat. You might be able to participate directly from the chat.
Thanks, Denise.
Amazing. We have 236 people on to listen to this. This is amazing today.
I know. And it looks like we already have 50 responses. And survey response is always a big one. How do we get people to fill out the survey responses? Which there's a lot of different modalities now that we can talk through on how you get those surveys out. How do you remind people around surveys? How do you make sure you're in compliance when reminding people around surveys? Looks like staffing shortages is coming in as a close second. This is really helpful. So survey responses. Michelle, what in your opinion, what are some of the ways that you've encouraged or seen an improvement or increase on getting those responses back? What have you implemented? Any strategies off the top of your head, since this is kind of fresh for the group?
Yeah, you have to look at it very different ways. Think about where your patients are. Your home patients, when you go and see when your staff goes and sees those home patients, the family, most of the time, I'd say 75% of the time, are there at the home. So they're very well involved. So you're doing all of your teaching, all of your efforts, all of those things to that family member. Let's take it a step further. Now we have a patient that's in a personal care home, an assisted living, or even a skilled nursing facility. Think about who you're teaching all of those things to. 90% of us fail the family at this level. Even though the family's not involved, they're saying, I need help. I can't take care of my loved one at home safely. So I have to put them somewhere where they can get the help. The family is still the driver of that care plan. So if you're not daily or every visit talking to that family member, you're missing out on a key piece. You also need to be providing all of that education to the family, not just the staff. The staff at the nursing home can be your best friends and give you wonderful referrals and things like that, but they're not going to be doing the referrals or the surveys, sorry. So you really need to direct all that teaching and everything to the family. I know I meet families sometimes just at, hey, I'm at Starbucks. I know I missed you today at mom's visit. Are you going to be around so we can just have a cup of coffee? I need to go over with you some care plan changes and some things that have happened. Or can we do a Teams meeting, kind of like what we're having today? Or do you have time for a phone call? I'm a big proponent of sending out emails to families. So on admission, I strive to tell my admission people that I have to have at least addresses, telephone numbers, and emails at the least, because I do share a lot of information via the internet or via email, those different types of things. I direct them to our website. I'm constantly putting on things about end of life care, teachings, all those different types of things. So you have to do it all the way through the process to get those survey responses. And you have to, even after the patient passes away, part of your post bereavement should be, don't forget, if you loved our care and love the care that we continue to give you, please make sure that you fill out that survey. Every discipline, from the aide to the nurse to the chaplain, the social worker, the marketer that may follow back up. Every person, if they have any type of relationship or built a relationship with this family, they need to be comfortable saying, I really need that survey back.
Man, you just teased out so many things that I want to dive into, and I know we only have an hour, and these sessions go by so fast. There's two key things I want to take away from what you just said, Michelle. One, and I think Andrea and Abby in the chat also were like, yes, this. How do you educate on the survey results of facility staff versus hospice staff? That is difficult. I think at Better Leave, what we've seen is when we remind families of surveys, because we do it in a consistent, automated way. So everybody gets the same reminder, which is in compliance at the same time. We will say, we hope you had an amazing experience with, let's say, Village Home, Home Health and Hospice in the staff. And so we can remind and we can educate the difference of, like, don't forget Village is the hospice group. And maybe, I'm trying to think of an assisted facility nursing, like, that's, we'll just say Deaconess assisted living. There's ways to make sure that you differentiate. But I think that's really important, Michelle. Train the team to make sure you differentiate of, like, we're Village Home Health and Hospice. We are not, Deaconess nursing facility. So I think that's a big one, right? Is making sure to educate families on the different teams so that scores are not confused or mixed, because some people might have a very different experience, right, between a facility and the hospice or home health
Correct.
provider. Yeah.
So one of the biggest things that I do, and I made one of these for this meeting. I didn't put Village on it, but I don't know if y'all can see this or not. But this is something called a write it down book. If any of you have ever seen Barbara Parnes in a in service or anything, she'll talk about this. I just took it to a different level. I use these little books. You see, they're like half the size of a composition. These are the best sizes. I've tried many different sizes with this. This seems to be the best size that works because the family keeps it. So I have just a little sticker here. I don't know if y'all can see it, but it's called Write It Down. And I have our 24-hour phone number. You can put your sticker right on top of this, or your logo, so that they know exactly what happens, or who they're directing all this to. You want to make sure that you get your name of your company out there so they know that it's you. What was the name of my hospice? I don't want anyone to ever be able to say, oh, I couldn't remember the name of my hospice. So always, and I always refer back to this, and the big key to this is getting every team member on board with this. This is called a write it down book. On the inside, I have a little message strictly about, thank you for allowing us to be part of this most precious moment that you have. And then the rest of it's blank. So the education I give them, we give them so much education at admission and every visit that we go to. By the time we're ready to walk out the door, the family member is overwhelmed. This is strictly for families. It's not for the facility. It's not for the, that best aid that you have there that does everything for you. This is strictly for the family. You tell them to write down any questions that they may have when you leave, because you're coming back. And this is extremely important for that admission day and that 24-hour follow-up. I just did an admission yesterday with a patient, and the lady comes back with this piece of paper where she's written all over it, and she goes, oh no, I left another piece of paper at home. I had more questions. So I was working for an agency, so I pulled one of these out and gave it to her, and it didn't have any other thing on it besides write it down. And I said, here, take this. I'll be back tomorrow to do the 24-hour follow-up care. I want you to write down any questions or any concerns that you have. And I know we spent a lot of time that day talking about pain. Her husband has prostate cancer, bone cancer, has met some bones, and she wanted to know, how am I going to know how he's in pain? So I just simply went to the internet, printed off a little pain aid scale, like size of a postcard, made it a sticker, stuck it right in here, and I explained that to her. And I told her to, from time to time, when you come and see your husband, just look at him. What do you think it is? our goal that we'd set up on admission was for him to be at a 2 or less anytime. So anytime you come in and you see that his pain is above a 2, I want you to call the office. This is our number right on front. So this is a great communication tool to get all of that information out to them and to build that relationship with every one of your staff. Every one of my staff goes in there, says, "Hey, let's look at your book." Not only is it an informational tool, but when it comes time the patient has passed away and they've been on services, let's say 30 days, 2 months, 3 months with us, it's a reminder. So when they
Mhm.
get ready to go back and do that survey, I love when Kara said this. And I always bring some little something in my bag to put to sticker, because I make a lot of stickers to go in here there so you can make them patient specific, like just an encouragement day. Not all the time is the patient declining or there's changes, but there's always reminders where we can give the family education and encouragement. So
Mhm.
that is what they're going to
Mhm.
remember, and that's what's going to that's going to what help to persuade them to do more of your surveys.
I love that. And you hit on personalization, which is key. I know a couple people in the chat said the slides aren't progressing. I know, I'm sorry, we're still on the poll slide. So I'm going to pivot us. I'm going to keep us moving, Michelle. But that is really helpful, and we can keep talking about how to get more survey responses back. And I know staffing is also a big thing as well. How can we equip? And I think this book is a perfect example. How can we equip our team with more tools in their
Hmm.
toolkit? Um, and so I'm going to keep going, and we're going to keep talking about these things. But the one main takeaway that we wanted everyone on the call to remember is the word fam. So family centered is the F. So we've already started talking about family caregivers, family centered. A is for actionable. So how can you take action on programs that are repeatable, actionable? And then the M is measurable. How do you measure success? It looks like in the chat too, we have Michelle. How do we ensure compliance around emails and texting? And then Kip has asked, do we have a sample of the Write It Down book? Kip, I'm going to have Michelle's email at the end of this slide. So if you want to email Michelle also to ask about the book and how she does it, you can reach out to her. If that's okay, Michelle.
Hmm.
Feel free to do that. But
So
while we're looking,
let
what do
me
you say,
answer the
Michelle?
HIPAA and the compliance, the HIPAA compliance and the email texting.
Yeah.
So I don't use names. So with HIPAA compliance and emails and all of those things, you have to make it undescribable. So if I'm texting Kara about Louisa, I'm going to say, Kara, your little one, I have some information for you. So like when I told you with the patient that I use that I send, email, I can call her Mrs. X, who was my patient, but everything else I say your husband or your loved one. And then there's nothing as far as
Private health
education.
information. Hmm.
Yeah, education, that's just general education that I'm giving them, like signs and symptoms of when death is near, or just education on pain aid, all those different types of things. As long as you cannot identify a person, you've not gone against HIPAA. So those I learned to use those different pronouns that we love here in the South.
I mean, it's a really great question too, and HIPAA is obviously a really important framework. And each group and each agency, they should have their own protocols and procedures that align with their HIPAA standards, and that might look a little different for every group. One thing that when we work with groups, is use email and use text messaging platforms that are HIPAA certified. So, for
Mhm.
example, Better Leave goes through rigorous training and under scrutiny of a third party group that monitors our HIPAA compliance and our SOC 2 compliance. So it's one thing as an agency to have your protocols and procedures to make sure you're in compliance, but any software that you use or tool that you use or even EMR that you decide to use should also undergo third-party HIPAA compliance and auditing. So Better Leave does as well. So Michelle gave a really great tip on how to make sure you're just constantly educating and not talking around personal health, identifying personal health information in those types of messages. But if you do decide to use a tool or a third-party technology, they also should have their own HIPAA protocols to make sure what they're sending aligns. At Better Leave, we do.
Mhm.
Really great questions. So we're going to dive a little bit into family-centered. We've already started talking a little bit about this, but moves us to our next poll, which is on the call today. How do groups currently deliver family resources and support? And when you think about those touch points, now we're going to really talk about those moments, those critical moments of care, from admission throughout the journey, from maybe bereavement when someone passes, or in some cases, a lot of groups that we talk to don't really have formal caregiver communications or set messages that go out. Or maybe, like Michelle mentioned, they don't have a book, a write it down book. So curious on the call how many groups are doing it kind of ad hoc, formal process. Looks like a lot are ad hoc right now, ongoing, depends on the different team members.
So when you interview your staff, and I want to talk about mainly your primary staff, your nurses and your aides, do you in your onboarding process with them go over good communication, how to provide education, um, what's the easiest way to do these different types of things? Are you giving them the tools? I'm a firm believer, if you don't give your tools at the very beginning and teach your staff the way that you want education to be done with the family, then you're setting yourself up for failure. So you need to make sure that when you're hiring staff, education is one of their first things that they want to provide. You can have a nurse go out and do all types of tasks. A lot of nurses are very task oriented, but when you come to hospice, home health, these home health avenues where you're dealing with families and geriatric population, we really need someone that can focus on that education. The educational theory behind a lot of teaching is that you've got to teach something 3 times, 3 different ways for them to understand it. When we talk about CHAP and Medicare guidelines, if you say in your note that you're providing education on pain aid, we need to be able to describe to them exactly what we are providing as far as education. I attach all of my education worksheets and all those different types of things to every one of my notes. But you've got to get your staff to doing that. And that is a very hard process to get them to be on board with all of that. But if you don't set the expectation as the leader and your staff, when yourself, if you go out and see patients, they're not going to follow you, and there will be at first a lot of pushback, but you've got to stay on top of that.
Yeah, the training is so important.
Mhm.
We see that a lot, because if it is ad hoc, you might be getting survey results back, to tie it back to the survey results. You might be getting results back that skew based on what team members or what individual nurse. You got to create that consistency so that even though you want everyone to have their own personal communication, that what works best for them. Some people prefer to text, some people prefer to have the write it down method. You want to make sure everybody is getting that same consistent level of care, no matter what type of communication that they have. So I think you hit that right on the head. You've got to train the team, create those standards
Mhm.
of what you expect, so that everybody gets that same level. It looks like also at admission, a lot of people try to set expectations with family members at admission. Super important. We see that a lot. What's the biggest challenge around admission, Michelle? You and I've talked about this. It's overwhelming.
Very
It's
overwhelming.
a lot of documentation,
Mhm.
and sometimes, like most of us, we need time to process. And so that 24, 48, 72 hour period, really important to check back in. How are you
Mhm.
doing? How are you thinking? How are you feeling? Do you have any questions? And that's where I know you and I, that when we've worked together, your process, you've built in ask questions 24
Mhm.
hours. And then we send text messages within 72 hours. Do you have any other questions can we make sure that you're getting what you need? And we just do these nice little check-ins. That's what I call like a check-in. How you doing? How you feeling? How do you have any, like, that's so important from admission.
Correct.
I
So
think,
Julie has a statement she here says each facility also has a preference on communication. You're exactly right. Part of our regulations makes us or says that we have to have good collaboration with facilities. Think about every time I go into a facility or an assisted living, every assisted living has a little different piece of paper that you have to write down for them exactly what you did and what you saw for them for that patient. I get it because they don't have nursing, per se a RN or a nurse. Sometimes even on the premises they have one available, but they're not there. Those types of things also need to be put into your note to show that you're doing that. Um, because how else are you going to say that you provided that coordination of care? If you have something that you're teaching that staff, you have a patient that has a very bad wound, and you're teaching them not to put them on that wound and how to put the pillows around to make sure that they're safe and doing fall safety so the patient doesn't roll out of the bed, because now most of the assisted livings are not allowing bed rails anymore. So all of that education that you're giving and you're writing it down on that little communication sheet that you're giving to that patient, to that facility. I use TigerText. TigerText is very HIPAA compliant. There is a place on there where you can scan every document that you do up into TigerText, and then my office adds it to our chart. Those are all things that you need to prove what you're doing, and that's how you're meeting the regulations. I think as hospice companies and staff that I've talked to, many people that I've talked to over the years, they talk the talk, but they're not walking the walk. If you're doing the education, for all of you that are healthcare here, are nurse trained, it's not done unless we document it. If we don't document that we're doing all of that wonderful education with the facilities and the families, it really never happened. Medicare's never really going to see it. So those are big things. And with the Hope Project coming in, that's even going to be more requirements that you need to do. They're putting different time frames in, and what are you doing to prevent events from happening again? Anytime there's a change in condition, what are you doing to prevent that from happening again, such as a urinary tract infection or an upper respiratory infection? Education is going to become very important when it comes into the Hope Project, and providing that education to the right key players.
I love that, Michelle. It's a perfect segue into this next slide, which is you have to train your team, and then once you educate and hire and train, they have to go out in the field, make phone calls, send letters, do all this type of communication. And we hear a lot, staff burnout, right? And families are really distributed today. So what we've seen is by using digital forms of communication like text and email, you're able to reach many, many, many more family members. And let's be real, like most of us have a family unit. It's not often just one person that is taking care of mom or dad or whoever is in the hospital. It's a family unit. It might be the aunt, the granddaughter, and so having a text-based program we've found allows you to message multiple different family members at one time. Talk to me, Michelle, about how has text-based communication helped you at Village build trust with like large distributed families, or by checking in more? How have you seen those kind of interactions impact your scores and results, or increases in your survey? Feedback.
Okay. So I think I've been with you guys about a year and a half now, right? With us. Okay.
Yeah.
So before I started the texting platform with Kara and Sam, I didn't have a star rating. I had a census as high as 80 at one point, but I was not getting those surveys back for you to have those different star ratings and things. When it came to family, what's the other one? Not the star rating, but the family, where the family
satisfaction.
rates you with, the satisfaction. I had that, and it's always been 5 stars. I've always had really good communication with the families, but I was missing something. I have all of these people that tell me, yes, we do really great, but if we sent out 30, to 40 uh, survey links for Fozzie to get back, or whoever you use to get back, I may have got back 2 or 3. So that doesn't really hit you with your star ratings. When I worked with Sam and Kara to design, I sit down and we pulled all of those responses that I did get, and we looked at those, and I took it to both mine. I had both home health and hospice. And I said, let's look at this, let's tear it apart, let's come up together with what the patient says is the worst thing that we do. And then I want you guys as a staff to tell me what you think the worst thing is that we do. You can base it on your own opinions. You can base it on what you're hearing from your families and your patients. The number one response that I got back is both sides, hands down. The families or the patients do not know when the caregiver is coming. They do not know when the caregiver is coming back, and they don't know what to expect. Well, that's our whole program. Why are we not doing that? So I started breaking things back down again. I designed a little business card on the back side, and I made one of those funny cue cards, cue things. What's
Yeah,
those
the
little
QR, the
squares?
QR scanners. Yeah.
The QR scanners. And I linked it to our Google reviews. I only had like 2 or 3, and it was just somebody went on there and did like 5 stars, those different types of things. And I put out information to all my staff, from the aide to everybody. If you got a Google review posted, I would take you out to lunch. That was the first go around. So they just
Love
jumped
that.
on that to have lunch with me. And I don't know why, I'm not that special, but they wanted to have lunch. I got probably 15 reviews that month. So I took out, staff, and that kind of helped a whole bunch. And then I started looking at what they were actually, replying to. So I upped it up again, and I said, I'll give you a gift card, to Dunkin' Donuts, or Starbucks, wherever you want to go for a cup of coffee or whatever.
Yeah.
And my staff love that. I like going to get coffee. Just hitting something that they're going to get something out of, but it's also going to help you drive your process as to how you're looking at. So as I did that, I started to also we have boots on the ground Monday morning meeting, where my nurses and my social worker and my chaplains come, not my aides at this point, because they're busy in the mornings. I usually have a Monday afternoon meeting with them. So I started bringing all of these things that I heard, that I would see posted on Google, or anything that was posted with Kara and Sam, and I started bringing them to the morning meeting or to the case conference with home health, so that we could sit and we could talk about it, and talk about ways that we could make it easy for everybody to talk to the staff. One of the things that came out of them was, we don't know how to get, we don't want to bother your after hour staff, because they need their sleep to be able to see the patients during the day. I'm like, okay, wait a minute. I pay for extra staff just to be on call. They're not a case manager. They're not anything. So I started to ask, and my aides were the one that was seeing this a lot. I started to ask the aides, what's a good communication style that we can use to let them know that we have a special dedicated staff to the evening. They can call anytime if it's a question, whatever. So my aides came up with this little thing. We have fresh staff. I'm like, fresh staff, but it worked. So, my fresh staff at night, they were up and paid to come up and stay. We started getting more after hours calls with questions and things like that. So I poured in education to that staff to help me to have better communication, and I had them write down everything that was happening, that if they called, to kind of look at that. So we reviewed, and that review process and changing your staff and getting them to buy in is going to be the biggest key. So now, thank goodness, I have had on the average about 15 to 16 responses come back a month. So I have a 4-star rating now. So that is awesome. So the work that we put in is really paying off.
Oh, I love that.
So it is just awesome. I can't tell you how this is done. My rehospitalization rate is down on my home health side. My missed visits are down. So everything that we targeted and focused on those questions to use this platform to blast out to people, it just worked tremendously for us.
Oh, Michelle, I love that. You hit on two things before we keep going. One is consistency. So that was a big one. How do you make sure that there's consistency around communication of different staff? And the second thing that you hit on was what I would call employee engagement programs or employee reward programs. How can you build employee engagement and employee rewards around family caregiver communication strategies? You gave two ideas: take them to lunch, give them gift cards. We see this all the time. We have a program running with a different group. And based on the messages and the feedback that we get back via text, anytime someone's name is mentioned in a kudos, like our nurse Michelle was amazing, if they get mentioned 3 times, then they get to pick a swag item. So like a water bottle or a notebook or something like that. So there are a lot of different ways that you can build these employee engagement and employee reward programs around family caregiver communication. So love that. Thank you for hitting on that. We're going to keep moving. 1 or 2 slides left for the family caregiver area before we move into some actionable strategies. We're going to do just a quick self-assessment here around, hey, do you guys do these things? Things to think about, right, for your group. Are you offering different types of communication? So far, Michelle has hit on the write it down method. We've talked about texting. We've talked about virtual email. We've talked about printed resources, stickers. Another one, fridge magnets, we haven't talked about yet, but also a great way to offer support and communication. So these, we're going to leave this with you. We're going to keep moving, but these are things you can ask yourself after to see if your agency and group are doing these types of programs. And here's some quick ways to think about improving your family caregiver communications. And I'm just going to recap what we talked about for the last 10 minutes, which is the write it down system. We've talked about creating tip sheets and articles that are personalized to the individual and the family. Another great idea is start pre-bereavement caregiver support. So a lot of times, again, remember, people think bereavement is after someone passed away, but family members sometimes need support while their loved one is dying or in active care. And we call those caregiver support groups or pre-bereavement groups. That has been really powerful for a lot of our partners. There's also ways, different types of styles of communication that you can roll out, and the list goes on and on. So we're going to leave these low-cost action items for you to think through as some other ideas. And we're going to move into our second kind of key area, FAM. Remember, family-centered, actionable, and measurable. It's actionable. So this is a really big one, which is how can you, Michelle said it, how can you not only talk the talk, but walk the walk? This is exactly what we're talking about. How can you take actionable steps? How can you make sure you're proactive, collecting feedback, monitor your ratings, and then how are you sharing those with the group? Michelle, you just touched a little bit on, hey, I have my weekly meetings. I share this feedback in my weekly meetings. Talk to me a little bit about feedback, delivering feedback to the group. While we talk about that, I'm going to move it over into our next poll, which is how do you guys today collect feedback from families, and how do you monitor and act on it? And while we are getting this feedback, Michelle, you touched on it a little bit. I want you to dive a little bit deeper on how do you give that feedback back to the team, both maybe constructive criticism and also kudos. How do you do that with your team?
It is very important to look at both of them. On admission, after the nurse goes out and does everything that they have, as the executive director, I call every one of my admissions, and I'm their patient advocate. Yeah. So I give them my personal cell phone number, say, here, this is what, how I can help you. This is what my job is. And I'm just going to follow up with you from time to time to make sure everything is okay. And if we're doing something good, please let us know. If we're doing something bad, please let us know, because we're here for you to make this the best experience that we can. So setting that with the family and giving them that comfort to where they can call you and they feel comfortable enough to call you, I think that's extremely important. Having that conversation with the family, but you need to have that conversation with your staff before. It's okay to get a complaint. We're going to work through it and we're going to try to make it okay. No one's perfect. There, you try to get along and try to create happiness with everyone. But as a caregiver, you know that there are some people that, oh my God, I'm going to go see that patient again. Well, if we
Mhm.
feel that way as caregivers, the patients and the families feel that way too.
Mhm.
I'm a very warm, bubbly, hugged, like to touch, all those different types of things. Some families don't like that. I was a nurse up in Boston for 15 years. That kind of became intrusive. I'm originally from the South, where we always have those different types of, I call them Southern charms or things like that. And that's not really how their culture is. So you have to really understand what the culture is. So my personality probably will not work with someone that's not that lovey, touchy, those different types of things. I understand that. Doesn't mean I'm not a good nurse, doesn't mean I'm not a good person. But we all know that we have some weaknesses or some things that other people are not going to like about us.
Mhm.
But that's okay. But we need
Sure.
to embrace that and be able
Yeah.
to change, make those changes happen, because it's not about us as the caregiver, it's about the family and the patient to make sure they
Mhm.
have a great experience. So
And it's
having those discussions, we also need to make sure that we're having that and listen to have the staff. I got this complaint, but we want to look at it constructive. I never give names. I never try to leave out as many details as I can to be as vague so they can't really figure out what patient I'm talking about.
they don't take it
But
personally.
I really want them to focus on how we can make it better.
Mhm.
In my
Mhm.
whole entire career of being in hospice and home health for 15 years, I've had to transfer 2 patients because I could not make them happy. And that's
But that's
okay.
low. I mean, that's low. That's okay. I mean,
Mhm.
it's I think you hit on two things. One, you have to deliver continuous feedback, good and bad, to the team. You have to do that.
Mhm.
And if you can create it in a way that is helpful and not and doesn't feel like a personal attack, you have to be able to do that. The other thing is you have to capture that feedback before it's survey result time because you need to
Correct.
try to change the perspective. You need to try to fix the issue. You need to try to take action. Remember, this is all about action. You need to take action. It will directly impact your CAP scores. Taking action on that negative feedback sooner, we've seen is really, really successful. And it looks like from just the survey poll quickly here, a lot of people ask for continuous care. And I think the second thing is, are you capturing it? Right? How are you capturing it? Are you writing it down? Is it ad hoc? Make sure you have a process of how you capture that feedback and you can go and measure it. So we're going to talk about the measure part here in the last 10 minutes, but it's one thing to have to ask for it, and then it's another thing to be like, oh, the last 20 patients in the last 2 months asked the same thing. Well, you have to be able to capture that. To Michelle, your point, you knew you had the data from battery leave to say, oh, these were the questions asked in the last 3 months. So now we know we need to change this process or do this better. So I think that's really, really important. And here we have a couple stats on why it's important. We've seen that high performing hospices receive a lot of net new patients and new admissions from family referrals, word of mouth. It's a really big one. So those Google reviews you were talking about, super important. Making sure you're following up, really, really important. Taking action and getting ahead of those survey responses. Also really, really important.
Mhm.
I know we have about 10 minutes left, and I have one more key area, so I'm going to be moving a little faster through these last slides. Michelle, I knew this conversation was going to fly by, so we're going to keep moving on. But again,
Okay,
if
I
you
was
have
going to
any,
say something else about the family referrals.
yeah,
I have one marketer who does not get most of my referrals. Mine come from family referrals or self or past experiences. I just want to give you one little story real quick. I will be
No,
quick.
feel free.
I
Yeah.
had this one little family member that she was one of those people, oh my gosh, I have to go see that patient again. And it's not the patient, it's the family member. But she became our best advocate in her neighborhood. They lived in a 55-year-old neighborhood. And she'd go out walking her dog and she would say such wonderful things about Village. And we thought, that she just hated us with the amount of times that she calls and complains. But her complaints were actually her grief and how she processed her grief.
Mhm.
But that lady gave me 6 referrals after her father passed away.
Yeah.
Every time she gave me a referral, I delivered flowers to her home. She loved fresh flowers. So,
It's
I could
really
go and pick
thoughtful.
up a bouquet at Kroger or, the local store and rearrange them for her. And I mean, it cost me like 25, $30. How much money do you make off of that referral? So
Yeah.
making sure that you keep that referral source and giving that positive feedback to that family is good too. Go
Oh, I
ahead,
love
sorry.
that. I love that. It's those little things, right? That go above and beyond that take you from good to great. Um, and it's why it matters. I love that. Self-assessment time. So a couple things to ask yourself after this webinar. Do you have a way to identify families that maybe need more support or are maybe not happy or need more expectations? Are you tracking your online reputation? If you're not looking at your Google reviews, do that now. Things like that.
Mhm.
And here are a couple low cost action items that we want you guys to take away with. Ask for feedback in real time. Don't wait for after they've lost someone. Make sure not only you're sharing negative feedback, but positive feedback. Boost people up in those meetings. Team members love to hear around kudos. I mean, very mission driven teams in post acute is what we've seen, and really, bringing it back to their why of helping people. Man, it is such an awesome experience. So make sure to share positive feedback as well. And then you can set up some really quick Google things. So you can set up a Google business profile. You can set up a Google alert. You can add things onto your website to make sure that you're driving more referrals and more education. When you're for your sales and marketer, share that feedback as well with your sales and marketer, and then they can take it back to facilities or other kind of third party groups. So use that feedback however um, works for your team. And then the last area that we have is how do you measure a program? So this is really, really important. We have about 5 minutes left here. Michelle, one thing I wanted to ask you around measurement, obviously, because some people might think family caregiver communication is really squishy and high level and ad hoc. I mean, you and I, when we partnered together, we set some really clear goals and outcomes and measurable KPIs. What are maybe some key top 1 or 2 areas that you think are really important to track or measure around family member communication and family member engagement?
When you go to Quappy, you're always looking at things that how you can improve, but you also on this family side, you want to also put in your experience as to what has worked and what has been successful. When you're making, you need to figure out and do like a poll, like she's doing here with some of your families. Just pick up the phone, call them. Where are we missing the point with family? With our interactions with you, what can we do to make it better? Remember all the different areas that you have, from home to assisted living, personal care homes, to SNFs, to GIP, to all those different types of things, the inpatient units. Every different level, you need to talk to those families because there are different needs and different communication styles.
Yeah.
You just need to be open. The most important thing that you can do is don't set yourself up to fail with goals that are unattainable, and make sure when you do your goals that they are clear and they're measurable, and you have a device that is a consistent way that you can measure. Not, oh, I'm going to measure it this way for this question or this way for this one. You need to make sure that it is consistent and it is truly a measurable to where you can see that you've gone from okay to great.
Mm-hmm.
Um,
Mm-hmm.
so, and just and put up challenges for your staff. If you're not meeting that outcome, we're only at 50%, and I don't understand why I can't get past this 50%. Put up challenges.
Yeah.
For most of you that don't probably know, everybody here knows me, but I used to be a kindergarten teacher. How can I get my kids to do what I wanted them to do? I could draw all over the board, put up polls, make a big thermometer, and say, we're here. What is it going to take to get us here to the top to make us proud of what we're doing? Um, different types of things. Make the cruise ship go down the wave or whatever. Be creative. But you need to engage your staff just like you're trying to engage your families. And that's the only way that you're going to make this work.
I love that. And you can use some of those polls like the thermometer. You can have certain questions. Like a lot of the groups that we work with, timely communication is a really big focus area, especially on their CAPS and their family satisfaction survey results. So they might have timely communication and they might have that thermometer and they might be tracking what questions are coming back around timely communication and things like that. So I love that. You got to have the visual cues as well as some of those hard outcomes. So we only have a few minutes left. I'm going to quickly go through. It looks like majority of the group does actively track family experience and outcomes, which is amazing. There is a significant portion though that needs to start building that. So hopefully we can give you a couple low cost action items here of how to think about how to build that continuous check-in for your families. And gonna remind people before we wrap up here again of our acronym to take away. It is the family centered, it is the actionable and measurable. These are the 3 words, again, kind of take this away from today's meeting. I would say questions, but we have been getting a ton of questions in the chat. So thank you everybody who was involved and engaged and interactive on the chat and the polls responses. This has just been so incredible. Michelle, thank you so much. She has said it is fine to put her email in the chat. So anybody that wants to chat with a thought leader, again, across the post-acute space, learn about her methods for success. You can reach out to her there. You can also reach out to me as well, Kara at Butterleaf, if you want to learn more about our family communication program. But anything else, Michelle? I know we have like 1 minute left. I see Denise has just come on, but this has just been so awesome. So many nuggets and so many takeaways. Great.
Yeah, well done, you guys. What a great conversation. It was a pleasure to listen in on you. Before we close out, just a quick reminder that there are some do's and don'ts around maximizing your CAP survey responses. So just making sure everyone is compliant with those pieces. There are definitely some specific things that you want to avoid as far as contacting families regarding their responses, right? And also just being consistent around that. Whatever practices you are doing, you want to make sure you're doing that with all of your families. So you're really soliciting, the full scope of responses that you might get, right? So I really appreciate both of you. I thank you both for bringing this conversation to us today. Just a quick reminder to everyone here, the recording will post. You'll get an email that is a legitimate email. It's sent on behalf of CHAP with a link to the recording. And then we will also post this on our webinar YouTube channel as well. So thank you both for taking the time today, and I hope everyone has a great rest of their Wednesday.
Thank you so much, Denise. Thanks, Michelle.